Welcome to the 10 Things You Need to Know About Running Injuries. I'm John Wolf from Proactive Physical Therapy, and over the next couple of video series, I'm going to teach you some of the common understandings about how running works and some of the things you need to know so that you can decrease running injuries and treat them. At Proactive Physical Therapy, we're an organization dedicated to developing custom solutions for pain and developing strength, conditioning, endurance, and recovery training programs that result in lasting fitness and optimum performance. I'll tell you a little bit about me. I'm a physical therapist that studied at Northern Arizona University and graduated in 1989. I went on to study biomechanics and motor control at the University of Arizona and also worked as the rehabilitation coordinator. I was a director of sports medicine for the U of A between 1995 and 2001 and was also a medical crew chief for Chris McDonald, who was a 2005 Race Across America participant. I'm the co-director of the International Academy of Orthopedic Medicine, a continuing education company that teaches physical therapists and other professionals about the orthopedic medicine. I'm certified in orthopedic manual therapy from Berlin in 2002, and I'm on clinical faculty at the University of Arizona Sports Medicine, Surgical and Non-Surgical Fellowship programs. The first of the 10 things that you need to know about running injuries is pain. And one of the first questions that most people have about pain is what's causing the pain, and they want to know why it hurts. Pain is a combination of three processes. There's a chemical component of pain, there's usually a mechanical component of pain, and lastly a psychosomatic component of pain. For those of you who are interested, here are some of the details of the chemistry that's involved with pain. All of these chemicals on the left are those that your body produces in the response to an injury. And the effects of these chemicals are to bind to specific receptors in your nervous system and subsequently cause a chain reaction of electrical activity that begins to send a signal to your brain that tells you that you have pain. This chemical signal is generated by a fairly complex interaction between the tissue damage and the nerve system right here. This is kind of a slice of your spinal cord here, and what happens over these nerve fibers that are very specific to carrying pain, an impulse is generated out at your muscle or your tendon or your bone, and it travels in the electrical current into your spinal cord. And from here it's sorted out, not unlike a supercomputer will sort out information in order to bring it towards the more sophisticated part of the hard drive. The fancy word for perceiving pain is called nociception, because there are small receptors at the end of these nerves called nociceptors, and they're very specific to receiving pain. So as I mentioned, out here in the periphery, or out there at your tendon or your muscle or your nerve, you're going to feel the sensation that's going to come up through your spinal cord and into the supercomputer of your brain. And here's a very sophisticated sorting process that your brain has to go through to help you interpret what the information is. The chemistry can be a fairly complex discussion. However, what you might want to recognize is that how is it that we treat pain in this country? Most often it's with some sort of chemical, some sort of anti-inflammatory medication, or something that begins to help to mediate some of these chemical processes that result from injury or overuse. The second component of pain is mechanical, and for most musculoskeletal injuries or injuries with runners, most of the time the pain starts because of some mechanical problem. In other words, the mechanics of the ground or mechanics of the body have elicited a specific chemical response in the bone or the tissue in order to depolarize or to make that chemical signal get sent to the brain. And this is very important because if there is a mechanical problem, you're going to want to know about it. It's one of those built-in protective mechanisms that the body has in order to make sure that you don't break something permanently. Lastly, pain is also psychosomatic. And that does not mean that people make pain up, but rather it means that there's always a relationship between what you feel as pain and how you react to it. And this is a very, very sophisticated system that starts, as I mentioned before, with some activation of a pain receptor that goes into the spinal cord, up through the various tracks in your nervous system to the part of your brain where you have to begin to interpret what it means. For most of us, pain is a very emotional process. Think of it. The last time you had pain about something, what kind of emotions did you experience? Were you frustrated? Were you afraid? Well, all of those kind of emotions happen inside your nervous system, and they're very important in informing you about what you should do with the pain. So pain is psychosomatic because in some level you have a choice about what you do with it. There are many people who treat pain differently. Of course, one of the most famous athletes that we know about said that pain is temporary. It may last a minute or an hour or a day or a year, but eventually it will subside and something else will take its place. If I quit, however, it will last forever. Well, of course, we know about this athlete, and I suspect that at some level, using the right drugs will make a difference in what kind of pain that you feel and when. So once somebody has pain, there's a cycle that can be pretty well expected. And we know that people with pain often have some kind of anxiety about it. They may subsequently not sleep well, not necessarily coping, which can lead to the chemistry in the brain that actually increases the pain. And we know that pain has other consequences, such as worries about the long-term outcome, the inability to train, the inability to meet goals, and for many, running is a process of managing stress. And if you can't run because of pain, then many people are concerned that they're going to gain weight or they're not going to be able to manage the stress in their lives. One of the most common questions that I answer as a physical therapist is, why does it hurt? Or, is it pain that is good pain or a bad pain? Is this pain that I can push through? If it hurts, when should I stop? And they're constantly asking, how do I know? And if you're like most runners, you're going to want to know sooner than later. Many of you may recognize that we kind of have a healthcare dilemma. Many people are having difficulty in getting prompt answers to their questions. And a few professionals trained in musculoskeletal injuries really are so busy that they don't necessarily have the time to get patients in quickly. And recognize that there are folks out there constantly looking online in order to get information, and this creates a gap in the information and necessarily what the information means. So we recommend that you get a solid relationship with professionals who help you get the answers to what's causing the pain, who can take the time to teach you what it is and offer you options in the care available to you. So there are 10 things that you need to know about running injuries. Number 1 was about pain. Number 2 is about gravity and how to manage it. Like the cartoon says, gravity is a strictly enforced law that we really have a difficult time disobeying. Unless, of course, you have springs like a small lamb. And some of us do. However, gravity is a constant force, and there are very, very few exceptions. The body is actually designed to manage gravity well if it's conditioned properly. And gravity is essential for nutrition of specific spinal tissue, specifically the cartilage of the spine and also the cartilage of the joints. And the body adapts to this gravity when it's dosed properly. Unfortunately, many of us are not necessarily designed to manage gravity well, and it's not uncommon when I work with patients that there will be all kinds of negotiation about how it is that we can change your relationship with gravity. And the advice that I usually give people are two. One of them is you can move to the moon, and the other one is that you can learn to live underwater where there is no gravity. So let's talk a little bit about how gravity impacts the body. You have to recognize that each step creates a multiple of your body weight. So during walking, you can anticipate that with every step, your body has to endure 2 to 4 times your body weight. If you're running, that increases up to 7 times your body weight. So you'll notice that the heavier you are, the more of you there is, and the more force that you put into your joints. And those forces have to be attenuated by your tissues, or else you are going to have some sort of pain. So a lot of runners, and you can tell that those elite runners look quite different than Homer Simpson, have a body mass index that is appropriate for the goals that they have with running. There's a power to weight ratio, and a runner's body is pretty evident. Most of them who are elite level look pretty much the same. But that doesn't preclude others of us from being able to be runners. We just have to know our limitations and make the right choices. The best way to manage gravity is to be less. In other words, the less of you there is, then the less that gravity can act on you. So our goals when we coach people into minimizing injuries is to lose unwanted weight. Just decreasing a couple of pounds is going to make a difference in how you feel and how your joints feel and how your muscles respond. And the next level is controlling what you have, increasing your motor control, your stability, balance, strength, and endurance, all of the things that we do and many people do in order to make themselves better runners by conditioning the joints, the flexibility, so that the muscles and tendons can do a better job of absorbing forces. This is a conclusion of part 1 of 10 things you need to know about running injuries. Please join us for parts 2 and 3.